you about Samir's condition?
Actually, doctor, he is very active. He's too much active. He keeps jumping from one place to another place. He doesn't do one work. He will be playing here, then suddenly he will go to play something else. And also I am repeatedly receiving calls from his teacher at the nurse at the lower kindergarten that he is always not sitting in his place. He's running, he's jumping, like this. So I know only this much about him.
Okay. Actually, I appreciate your concerns. Actually, Samir's having symptoms, which is hyperactivity and um, aggressive behavior or impulsiveness and less concentration. So this features goes with the diagnosis called attention deficit hyperactivity disorder. Did you heard about this before?
No, doctor, I haven't heard this before.
Okay. This disorder is the disease that we diagnose clinically. So when there is concern
What do
regarding
you
this,
mean by clinically, doctor?
okay, we mean that by taking certain information from the mother and the uh, caregiver, we can diagnose this disease, not by taking any blood sample or so on. Okay.
Okay, doctor. But doctor, I want to ask him. I feel that there is some problem in his brain, really, because nowadays he's giving a very hard time for me. He will not sit in one place. He runs, he jumps. Sometimes he breaks things at home. I feel really there is some problem in his brain. Why can't we do some imaging for him?
I appreciate your concern, but this hyperactivity, uh, we need to diagnose such problem by taking certain information regarding this hyperactivity uh, in more than one place, that to say in the at home and kindergarten, or one place he did such behavior. So we are concerned about the diagnosis of attention deficit hyperactivity disorder and not something in his brain. Okay.
Okay, doctor, but why can't we do this? Because maybe I will get satisfied that he doesn't have. I feel that there's something wrong in his brain.
uh, I appreciate your worriness, but he had no something in his brain structure. This due to behavioral problem, not brain structural problem.
Are you sure, doctor?
Yeah. We didn't know
Okay.
need to do certain brain image to diagnose such problem.
Mm.
Actually,
So, now tell
this
me how you can treat him now, because I am worried. As I told you, every day I'm getting call from the teachers. I'm worried. So, how can I solve this problem with him now?
I appreciate your worries, but we actually diagnose this problem at the age of 6 years. So at the age of 2 years, it is normally the child having uh, hyperactive and so on. But we will start the treatment by the age of 6 years. Now we need to start behavioral management. Is it
Okay.
clear up to now?
Yes. What do you mean by behavioral management, doctor? 6 minutes, 3 minutes
Uh,
left.
okay, behavior, we will give you an structure to how to care and treat these hyperactivity. So we will sit with the our team, psychological team, that will treat you how to cope with such hyperactivity uh, behaviors
Okay.
and
You will.
this impulsiveness.
Okay, this will be given to the parents as well as the child, or only the child?
No, the parent and the child, both of.
Okay, doctor. Any medication you can start for him? I think all these things will not work. He needs medication.
Actually, we will start with uh, um, these advices, and we will follow the Samir for a while, and then if there is no response, because there is many children improve with such therapy, behavioral therapy, I mean.
So you will not give him medication now?
Yeah.
Okay. What is the cause, doctor? Why they don't want to start medication for him?
Sorry.
Why they don't want to start medication? I think going to this behavioral therapy, we should have time. We are very busy going there and sitting with them. We don't have time. There is no better medication for him.
A lot of we actually measure the benefit for uh, and the risk for each medicine. So it is better to start with behavioral therapy, because a lot of children improve with this behavioral therapy, and a lot
Okay.
of unwanted effect associated with these medicines used for treatment of attention deficit hyperactivity disorder.
Okay. So,
So
doc, I have read in some papers that there can be some autism with this. Is it true?
there is
Autism.
you associated with attention
Yes.
deficit hyperactivity disorder.
Yes.
Yeah, actually, because these both of them are behavioral problems, so may associated with others, but not mandatory any child having attention deficit hyperactivity disorder to have autism. So I need to assure you that um, many children improve with behavioral therapy. So don't worry, we are here to help you, and we will follow Samir, and I will give you a website address to read more about the this condition. And if you have any concern or having any question, feel free to contact us. I will refer you to a psychologist team, uh, psychology team, to talk to you more about which uh, advices you follow regarding the management of Samir's behavior.
Okay, doctor.
Okay, so
Do you want to summarize?
yeah, okay. So Mrs. Rima, today we talk about the uh, Samir's condition, which called attention deficit hyperactivity disorder, and what is the how we diagnose this condition and how we manage such condition.
Okay,
I will
thank you.
give
Okay, okay, continue.
okay, I will give you a contact for support group, children's and parents having same condition. You will
Did
benefit from.
did you tell about leaflets and trusted websites?
Yeah.
You
I
told
will give
before?
you your website address to read more about the condition. And if you have any question or concern, we are here and we can arrange another meeting.
Okay.
Okay? Okay.
Thank you. I think
Thank
it
you.
went well, but regarding the imaging, you have to tell her that again, there also you have to use the same thing, benefit versus risk. Here, we don't think there is any benefit because this is by our, as you said, by our examination and by our diagnosis. This is not a structural problem. This is the problem in the function and the behavior. This is the functional problem which is due to the behavior.
Okay.
Benefit
Okay.
versus risk here, the risk is more than the benefit because the child is hyperactive and he may not cooperate you for the imaging, and you need to give some sleeping medicine which is not required when he has when he doesn't need it. So the risk or the is more here than the benefit. Okay, for everything you can use the same
Okay.
thing,
Okay.
benefit versus risk. Again, for the medication also, the side effects of medication here is more, and it is not recommended before 5 years. Okay, do you know what are the side effects of these medicines? Anyone knows why they don't want to give before 5 years? Usually they will not
Actually,
ask this question. This is just for knowledge.
actually,
Usually there is no weight loss, no weight gain, and insomnia. These two are the main common complications.
This is you read from guidelines or from where?
No, from textbook only. I read that this medicines for ADHD, they diphenylhyd and this atomoxetine and all this, they amphetamine, they all these have side effects. There is the weight gain is poor, therefore you have to monitor both height and weight every 6 monthly when child are on these medicines. And insomnia is another problem, sleep problems.
sleep problem and nutritional problem affect the appetite and also the blood pressure. These main three side effects.
It affects the growth, blood pressure, and what else?
Causes
Sleeping.
insomnia, sleeping problems.
Okay, there is also effect on the growth and blood pressure, right?
Yes. Poor weight gain, so we tend weight every monthly.
Okay.
Usually they did growth parameters and blood pressure and even ECG before as baseline before starting the treatment.
ECG and what else? Growth parameters and
Measuring the blood pressure.
okay. So anyone wants
If there is any history of sudden death in the family, these medicines is contraindicated.
okay. So we will
arrhythmias and hypertension side effect of this methylphenidate. Also, it will cause that. Besides insomnia and decrease growth velocity, it will cause arrhythmias and high blood pressure, hypertension.
So anyone wants to be the role player? I will do this scenario again.
I have one comment. Uh, I remember that we diagnosed ADHD after the age of 6 years. How in this scenario you said 3 years old. For two
Cannot,
years old it is.
no, I think it will be diagnosed, but you will not give treatment medication before 5 years.
Okay.
Anyone wants to comment on this?
Because they said that 3 years is the age of 2 to 3 years is the age of hyperactivity for normal children.
We can check about it. But what I know is below 5 years, you will not give medication. And below 5 years, you will just, in the NICE guidelines, there is that children below 5 years, how do you manage? Children above 5 years, how do you manage? There is separate. Okay.
Okay, they
So
at risk to.
if you have the information from any of the NHS, you can post, no problem, that it will be diagnosed only after 6 years. But in the NICE guidelines, they have given separate management for children under 5 years and children more than 5 years. Okay, which we will go through after this.
Okay.
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 Before
Okay.
that, anyone can be the role player, because some questions I think needs to be placed properly.
Okay, I will do for you.
Okay, no problem. So anyone volunteering to keep the 6 minutes time for us?
So you keep, no problem.
Who is the one keeping?
Me, Mayada. I will keep the time.
Okay, so please alert us. We will start.
Yeah. After 6 minutes, I will set.
Please, okay. Whoever is here, please see to it that the candidate should not speak for a long time. If you can also see the time, it should not be more than 30 seconds, because we have a habit of speaking more, which is not good. Okay. The role player can speak more. We should speak less. Okay, we will start. Good morning.
Good morning.
Am I with Mrs. Reema, the mother of Samir?
Yeah, that's me.
Hello, Ms. Reema. This is Dr. Noor, one of the children's doctor in this hospital.
Okay.
So today I am here to speak to you about Samir's condition. Do you want anyone to attend this meeting with us?
No, actually, I'm alone. You can proceed.
So, Mrs. Reema, can you tell us about his present condition?
Actually, I'm so concerned about Samir's behavior. Is hyperactive. Anyone complain of him? He's having aggressive behavior, doing conflicts with children in the kindergarten. So I'm so worried that it's having something serious.
I'm sorry for that, and I can understand your worries, Mrs. Reema. That's why I am here. I want to tell you that Samir is diagnosed with a condition called attention deficit hyperactive disorder. Have you heard about this anytime?
No, doctor.
Okay, actually, this condition, the children will be hyperactive. and they will be impulsive. That means they will do one work and immediately they will jump to another work. When they answer,
Yeah.
they think like this. Do you see
Yeah.
such things in Samir?
Yes. Yes. This is exactly behavior of
And
Samir.
okay, and also you see the inattention. He will not give attention to what you say. He will go around doing many things at once like this.
Yeah. Yes.
Uh, so we want to treat him so that he can come out of this. This is what I want to talk to you. Am I clear with you till now, Mrs.
Okay.
Reema?
This is something assuring. He will grow out of it.
Good question, Mrs. Reema. Actually, yes, because what I can tell you, what I can assure you is 2/3 of the children will grow out of this. Like if there are 3 children with this problem, 2 will come out when they grow up, like when they become teenagers, 14, 15 years, they will grow out. This is what the studies say. So we will hope for the best. Maybe Samir may also grow out. There's only 1/3 chance that he may not come out. This is what I want to tell you.
Okay. Okay, doctor. What is the cause of such condition, doctor?
Actually, this condition, as if there is no problem in the brain. The brain is normal. He is growing well and he's fine. It is the problem in the functioning of the brain and also in the behavior. They are active. So they need the behavioral treatment. Is it
Okay.
clear for you, Mrs. Reema?
Okay. It is clear. But what is behavior therapy? You mean?
Yeah, the behavioral therapy is we will refer you to an psychologist doctor who will treat about these problems. He will sit with you and tell you how to manage with Samir, because Samir is just 3 years old, and how you can overcome his hyperactive behavior. They will give you some tips, and also they will teach some therapies to Samir, some activities, so that through which you can bring him out. This is what they do.
Okay. I read in some website that such condition may associate with criminal uh, problems in the future. So those children will become an employee and so on. Is
Uh,
it true?
Actually, Mrs. Reema, as I said, at this moment, he's just 3 years old. I cannot comment on this. But as I told you, the studies say that 2/3 of the children will grow out of it. Means most of the children are coming out of it. So this is a good hope for us. And if they are growing out of it by that age, you will not have all these problems. Only 1/3 chance is there that they may have the same problems. So I cannot say. We have to follow up Samir to see that how his behavior continues. And with the behavioral therapy what we give, most of these children will not have these problems of the criminal ideas or other things. That's why we are, the NHS and the team is striving hard to practice this behavioral therapy.
Okay. Okay, doctor. Can you start him on medical on medicines, because I can't tolerate such
3 minutes
behavior,
left.
and
Okay.
anyone complain of his behavior.
Yes, Mrs. Rima, I can understand the way he may trouble you during your work or in the school, but as the parents and as healthcare workers and teachers, we should be patient, and we will for the medication actually, as per the we will not start medication for children below 5 years. Since Samir is 3 years, we have to first try the behavioral therapy only, because as you know, there are side effects of these medications which are not good for this age children. Uh, are you with me, Mrs. Rima?
Yeah, yeah.
Uh,
Okay.
so the benefit is less here and the risk is more. The risk of side effects is more. So we will always start with the behavioral therapy to these children.
Okay.
So you have any other concerns?
No, doctor.
Okay, so today I want to give you some leaflets, trusted websites, and also some support groups. I want you to give the contact numbers of some support groups so that you can get connected with them, where you will get the information about this disorder and how to cope up with the situation. Okay.
Okay.
And also, I want to tell you that I want to summarize to you that what we discussed today. Today, we discussed about Samir's condition, who is diagnosed as attention deficit hyperactivity disorder, and how can we overcome this condition and give him the best management.
Okay.
So, Mrs. Reema, if you have further concerns, you can always contact me anytime. Okay, I will be happy to answer you. And also, you will be referred to the psychological team for the behavioral therapy of Samir.
Okay.
Okay, thank you.
15 seconds remaining. Yeah, 15 seconds only remaining.
Okay, no problem. So please give the comments. Others can also give who heard the conversation. Was the candidate speaking more than 30 seconds? Anyone observed this? No comments. Ola and lots of people are here. Where are they? Rehana.
I think you did well. You did not speak too much. You were specified for timing.
Yeah, actually, they will ask mainly in this scenario. The main questions will be to you about the medication. Mother wants
So
medication.
you already addressed that you are not
Yeah.
starting because of age and side effects.
Age and side effect. You will say benefit is less and the risk is more.
Risk is more.
This is more important one. Again, the second thing will be asked here is the imaging. I think that there's something problem in the brain. You will tell that this is not a structural problem. This is a functional problem which is related to the behavior. So here the behavioral therapy plays the main important role.
Role.
What you
Yes.
have to tell. Okay. So these will be the main questions, and also the long-term effects. Again, 2/3 of the children will come out as they become teenagers. Only 1/3 will continue with the same problem, and they may also have some associated other problems like autism and obsessive compulsion disorder like this. But all these information will help you if you have a conversation with a medical student. If you have to explain the diagnosis and management with a medical.
But for mother, you will not talk about this obsessive compulsive.
Yeah, we will not talk. This is what I'm telling. So for the mother, we will tell that 1/3 may continue. Okay, but the good thing is 2/3. That means most of them will come out, right? So most of them will come out. Like this, you will give hope. But she asked very good question.
Yeah,
Like
she asked
the criminal. So you will tell at this moment, I cannot tell anything. He's very small, 3 years old. We will follow him up. This is very important. And you have to also give that the behavioral therapy is the best treatment
That's
with
therapy, and
children will
this is
come
the
out.
supportive therapy
Yeah,
at
with
this
which
stage.
children will come out and they will treat them in such a way that they will not go for all these things. It's less likely. Like this, you have to give her the hope.
Assurance.
And
You have to reassure her, assure her.
yeah, it's just talking. You should have art of speaking. That's it.